Right now, more than 700 kinds of bacteria are living inside your mouth. Some of them protect your gums. Some of them slowly harm them. And here's the part almost nobody tells you. That strong, burning mouthwash you rinse with every day, it does not choose. It wipes out the helpful bacteria right along with the harmful ones. For thousands of years, people cared for their gums with simple plant oils. And today, real clinical studies have put 6 of them to the test. Not folk tales, actual trials on real patients. So I ranked all 6, but not the way most channels do it. Not by hype, not by big dramatic promises. I ranked them by one honest measure: how strong the real scientific proof actually is. Before we start, one important thing. This video is for information only. It does not replace your dentist. If your gums bleed often or hurt, please have them checked. Here's the good news. Early gum trouble, the kind where your gums are red or bleed a little, is very often reversible with good care. The serious form, where the gums pull away and the bone is affected, needs a professional. No oil fixes that on its own. So think of everything in this video as a helper, something you use next to good brushing, cleaning between your teeth, and regular dental visits, not instead of them. Now, let us count them down. From number 6, the weakest evidence, to number 1, the best proven of them all. First, why does this matter more as we get older? After the age of 50, gum tissue can start to recede. The gums can become a little thinner and a little more sensitive. Small pockets can form where the gum meets the tooth, and bacteria like to hide there. The old advice still holds: brush gently, twice a day, clean between your teeth, and see your dentist. But many people also want a natural helper they can add at home. That is exactly what these oils are: helpers. Nothing more and nothing less. Let's see which ones the science actually supports. We start with the one that looks the most powerful but has the least proof in real people. Oregano oil got famous when wellness influencers started calling it nature's antibiotic. And in the laboratory, it's genuinely impressive. Its main compound is called carvacrol. In lab tests, oregano oil killed more than 99% of the mouth bacteria it was tested against. That's on the same level as a well-known commercial mouthwash. So why is it only number 6? Because almost all of that research was done in a dish, in a lab, not in a human mouth. When we look for proper clinical trials on real patients over real weeks, they're missing. Powerful in a test tube does not automatically mean powerful in your mouth. If you still want to try it, never use it undiluted. It's very strong, and it can irritate the gums. Mix 1 drop into a full tablespoon of a carrier oil, like coconut oil. Swish gently. Do not swallow. Honest verdict? Strong in the lab, unproven in people. Interesting, but not a foundation. Number 5 is one your grandmother probably knew about: clove. Clove oil contains a compound called eugenol, and eugenol is a real pain reliever. Dentists have used it for generations to calm a sore tooth. It also has some antibacterial effect. So the good news is real. If your gums are tender, a properly diluted clove blend can genuinely soothe them. But here's the honest limit. Clove mostly masks the pain. It calms the nerve, it does not rebuild the gum, and it does not treat the cause. The clearest results actually come when clove is combined with other plants, not used alone. In one trial, a herbal toothpaste that combined clove with neem and tea tree oil reduced plaque by about 60% over 4 weeks. That beat a standard fluoride toothpaste. But notice that was the team, not clove by itself. To use it, 2 drops of clove oil into 1 full tablespoon of coconut oil. Apply gently along the gum line with a clean fingertip at night. Never put pure clove oil straight onto your gums. At full strength, it can burn the soft tissue. And if you take blood thinners, ask your doctor first. Honest verdict? A good, gentle pain helper, not a treatment. Number 4 is one of the oldest medicines on Earth, myrrh. Myrrh is a resin, a kind of tree sap, and people have used it on wounds and gums for thousands of years. And this time, we do have real clinical studies, not just lab dishes. In several trials, a myrrh mouthwash reduced plaque and calmed gum inflammation. In fact, it worked as a useful add-on next to normal cleaning. So why not higher? Because the studies are still small, and researchers themselves say we need larger, better trials to be sure. And you may have seen claims online that myrrh makes gum tissue grow back. I looked for that proof. It's not there, not in solid human studies. So we keep it honest. Myrrh can help calm and clean. It does not regrow your gums. To use it, a 1/4 teaspoon of myrrh tincture in a little warm water as a rinse once a day. Gentle and steady is the idea. Honest verdict? Real promise, backed by small studies, a solid helper with more research still needed. Now we reach the top 3, and number 3 comes with an honest correction. You'll see videos telling you to buy Manuka oil, but here's the truth. Almost all of the real research is on Manuka honey, not the oil. So let's talk about what actually has evidence. Manuka honey is special. It contains a natural compound that stays active against bacteria in a way ordinary honey does not. And the studies are encouraging. In one clinical trial, people used a Manuka honey product for 21 days. The share of gum sites that bled dropped from about 48% down to about 17%. Plaque went down too. In a longer study on patients with more advanced gum disease, adding Manuka honey to normal dental treatment gave a small but real extra improvement. One caution, Manuka honey is still a sugar, so don't leave it sitting on your teeth all day. Use it deliberately and keep brushing. Honest verdict? Genuinely good evidence for the honey. Just make sure you know it's the honey that was studied. Number 2 is the quiet surprise of this whole list. Most channels rank neem near the bottom. The science says they're wrong. Neem comes from a tree used in traditional Indian medicine for centuries, and neem has been tested properly in real patients again and again. In several controlled clinical trials, a neem mouthwash reduced bleeding, plaque, and gum inflammation. And here's the striking part. It worked about as well as chlorhexidine. That's the strong antiseptic rinse that dentists consider the gold standard. As well as the gold standard, from a plant. The taste is bitter, that's the honest downside. But it's gentle on the tissue, and it doesn't stain your teeth the way the strong antiseptic can. To use it, a neem mouthwash or a few drops of diluted neem oil in water once or twice a day. Do not swallow it. Swish and spit. Honest verdict? Badly underrated. One of the best proven natural options you can find. And the number 1, the best proven of them all, is tea tree oil. Tea tree oil comes from an Australian plant, and its active compound cuts through the sticky film that bacteria hide behind. But it earns the top spot for one simple reason, the quality of the proof. In a careful clinical trial, a 1% tea tree oil mouthwash was tested against chlorhexidine, the dental gold standard. Over 15 days, the tea tree rinse significantly reduced plaque, gum inflammation, and the number of bacteria. And it matched the gold standard, without the staining and the taste problems that come with it. That's the honest picture. Not a miracle, a natural rinse that performs like the professional standard in real people in a proper study. To use it, and this is important, never use it undiluted. Tea tree oil is only for rinsing and spitting. Never swallow it. It's not safe to swallow. Use a ready-made tea tree oil mouthwash or a product made for oral use so the strength is correct. Honest verdict? The best evidence on this list. A true number 1. So, let's put it together honestly. Your foundation is still the boring stuff that actually works. Brush gently, twice a day, clean between your teeth, and see your dentist. On top of that, if you want a natural helper, pick one with real proof. Tea tree as a rinse, or neem.
Both are backed by proper trials. Add Manuka honey used carefully if you like. The others can play a supporting role, but now you know exactly how strong the evidence really is for each of them. Here's a simple thing you can do. For the next 30 days, keep up your normal brushing. Add one proven rinse, like tea tree or neem, and just pay attention. Notice whether your gums bleed less when you brush. Notice whether they feel calmer. Many people do see less bleeding within a few weeks. The studies point that way. But if the bleeding doesn't improve or it gets worse, that's your signal. Book a dentist. Don't wait. If this honest, no-hype look at natural gum care was helpful to you, please subscribe. On this channel, we look at what the real evidence says, the good and the overhyped. Take care of your gums and take care of yourself. See you in the next one.